So today I am joined by Dr. Scott McMahon, one of the world's leading experts on CIRS. Scott, thank you so much for joining me today to discuss CIRS, your new position as medical director with Molco, your personal life, other stories that we can hopefully go over as we just go through this interview. But thank you again so much for being here with us today on our Toxic Mold Sucks podcast.
Well, thank you for having me, Emily.
Before we dive into some specific questions about CIRS and mold, can you share a little bit about you? Who are you outside of being a doctor, and what led you into wanting to become a doctor?
You mean I'm allowed to have a life outside of being a doctor? Ooh, that's a
Yes.
new concept. So fundamentally, and I say that in jest, fundamentally, I'm a child of the Most High God. That's who I am, and everything that comes in my life comes as a result of that. But I'm a husband. I've been married twice, unfortunately. First wife has passed away. I have 8 children. I've been married to my current and final wife for just short of 16 years. I met her while doing some mission work in Nigeria. That's a story of the goodness of God. I've been a pediatrician working in Roswell, New Mexico since 1992. I didn't close practice. I retired from my practice about 5 years ago. Let's see, what else have I done? Oh yeah, chronic inflammatory response syndrome. I met Dr. Richie Shoemaker on the phone for the first time in 2009 and visited his office in 2010. I've been doing CIRS work for the last 15 plus years. That has taken me through a number of different iterations and things I never expected to do. I published 12 articles and just finished number 13 yesterday, working with Dr. Shoemaker and some others. I've done medical legal work. At this point, it's approaching 200 cases, and to be honest, I'm not even sure what that number is. I just know it's a lot. And that includes disability insurance cases, workers' comp cases, personal injury cases. So just a bunch of all of those. I've had the pleasure of speaking well, I should say, mentoring people on 3 different continents, which is pretty amazing. I've given, at this point, I think it's right around 60 presentations at various different statewide, national, and international venues, talking about chronic inflammatory response syndrome. I ran a clinic for CIRS for 15 years, 10 of those while I was also doing pediatrics. So that kept me busy. I just recently closed that practice about 5 months ago. And then in the last 4 months, I've become the medical director. Well, I should say I did some consulting work with Molco, but at this point, I'm the actual medical director of Molco, which is a first of its kind, revolutionary kind of healthcare that is looking to make mold toxicity, CIRS, what we call mold toxicity, to make it more affordable and accessible.
What got you into looking into mold to begin with whenever you met Dr. Shoemaker?
So that's a two-tiered question. There was a divine inspiration, and then there was a more natural, secular kind of way that happened. So the first thing that happened was in August of 2009. I had been asked by a statewide medical society to give a talk in January, so several months later. And I had spoken at that conference for the previous 4 years, so I really didn't know what I wanted to talk about. And November, I think it was right around Thanksgiving. Thanksgiving, it was coming, and these people were talking to me almost every day, like, what's your topic? What's your topic? We need to, get our continuing medical education. And so I did what all good Christians do when you don't know what to do, is I prayed. Said, okay, God, what do you want me to talk about? And I expected there's going to be like a one-word answer, like asthma, or maybe something a little more complicated, cystic fibrosis, or some sort of, pediatric disease that would be appropriate for this audience. But that's not what I heard. I heard pediatric mold exposure with a colon, the next great epidemic, question mark. And to be honest with you, that kind of shook me, because I didn't even realize that mold exposure caused illnesses other than like allergies. I knew it could trigger your asthma, or even in some cases cause asthma. But the idea that it did anything else had never really even entered my mind. And so I debated with the sovereign who created everything. I know it just sounds so ridiculous, doesn't it? But I debated with him for a minute, and then I said, okay, fine. And I sent an email to the organizers of the meeting, said, this is the name of my topic: pediatric mold exposure, colon, the next great epidemic, question mark. And then I kind of recall looking up to heaven and saying, okay, God, you have 10 weeks to teach me about this, and I have to do an hour-long PowerPoint, or a PowerPoint for an hour-long talk. And that was the beginning. Okay. And then about 3 weeks later, somebody came to my office. I saw their twins for their checkup. And at the end of that, he said to me, hey, Scott, would you do a favor for a friend of mine? And I said, who's your friend? And he mentioned his name. And it's like the light bulb went on. I said, isn't he suing the local school district because he thinks his daughter got sick from mold? I mean, I hadn't even thought about that. And he said, yeah. And I said, yeah, I'll talk to him. And 2 weeks later, I talked to him. So now half my time is gone. And he told me for a couple hours about the journey that his daughter had been through, and what happened to her, and all the different doctors that she'd gone through around the country. And they didn't get an answer until they found Dr. Richie Shoemaker in Pocomoke, Maryland. And they started telling me about the treatment and whatnot. And okay, well, that's really interesting. And as a result of that, in his lawsuit, I ended up evaluating 15 people who either had recently graduated from the school, were currently going to school, or one of them was a teacher. And by the time I had interviewed those 15 people, it was like, wow, I mean, these people are really sick, and they have a lot of the same symptoms. And then not only that, but then we drew some lab tests on them, the ones that Dr. Shoemaker had recommended. And I saw that almost 60% of these lab tests came back abnormal. And typically, if you do a whole bunch of blood tests on a whole bunch of healthy people, you'll only have 5% abnormal. But we had 58% were abnormal. And I thought, this is crazy. So time went on, and the end of January came, and I gave my talk. And my talk, I thought, was pretty amazing. I mean, everybody was just like stunned when I finished it, because I basically presented 13 of these 15 people, the ones that I had their lab tests back. And it was amazing. It was like they're hearing about a new disease for the first time ever, as I was. And then after the talk was over, I went back to the hotel room, and my wife was asleep, and we were newlyweds at that time. She didn't come to my talk. Can you believe that? No, I'm just kidding. But she was asleep, and I just started thanking God. I said, listen, you gave me an impossible assignment 10 weeks ago. And by God's grace, I trusted you. I believed you would do what you did. I had no idea what you were going to do, but you gave me all this data and saw all these people. And then I heard him say, mold's in the Bible. And I said, no, I didn't know that. So I Googled it, and I found it, and I started reading about it. It's 5,000 years ago, God set forth the principles of remediation that we still use today. And then, while I was, again, just kind of amazed and whatnot, he gave me a vision. And in that vision, I saw this lady She's probably about 25 years old. She was on her knees. She was crying out to God. She was praying and she's saying, God, what is wrong with me? I feel terrible all the time. My my bones hurt. I'm just tired. My brain isn't working right. I feel awful. I go to the doctor and they think I'm doing drugs, or they want to send me to the psychiatrist. Nobody knows what's wrong with me. Do something. And as she said that, do something, I heard the echo of like hundreds, if not thousands of other people who were praying the same prayer. Like, what's wrong with me? Do something for me. And it took me a couple of days to think about it and kind of let it sink in. But what I realized is God was saying, Scott, I want you to be part of the solution for this. And interestingly enough, he had already had me set up a corporation called Whole World Healthcare that I didn't know what it was going to be for. He just told me set it up like in September, and so I did. And then I was able to just start seeing patients right away. So I continued with those 15 people. I went out to interview with Dr. Richie Shoemaker, and he was extremely gracious. He showed me everything they did. He gave me copies of his paperwork and everything so that I could start a practice like this. And I got to see patients with him. I got to see how he treated, rationale, for treatment and whatnot. And then I applied it. I offered it to these 15 families. And 5 of them took it seriously and said, yeah, let's do that. And they all got better. And the other 10 didn't take it seriously and said, nah, I don't think so. I'm not really interested in that. And none of them got better. And so God just led me down this path to see that this is a real thing. And now 15 years later and 2,000 patients later, you couldn't convince me that this doesn't exist, because I've just seen so many people. I've given relatively simple therapy, and I've seen literally hundreds of them get their lives back.
When it comes to getting well from this, do you follow a specific protocol for each patient, or do they vary based on their symptoms?
It's a little of both. I mean, I follow the Shoemaker protocol, and but there's always a give and take in medicine, because everybody's individual, and some people can't tolerate this medicine. Some people can't get out of their environment. The most important thing is, I'm sure you know, Emily, the most important thing in any treatment protocol for, mold toxicity, chronic inflammatory response syndrome, is you have to get out of your environment, or you have to get it remediated successfully. If you can't do that, no matter what medical therapy and what wisdom I might pass your way, you're not going to have your optimal improvement. So yeah, and some people will have no improvement until they get out of their bad environment. And that's always a trick, and that can be very individualized, because some people are renting and some people own their home, and some people were sold the home under false pretenses, and previous mold was known about, but it wasn't disclosed. And so it's just walking with people through all of those different kind of variations, and then also applying the medicine and doing that in an individualized way would probably be the hallmark of how I treated my patients.
How do you help? Because, in today's market, how, rising prices and interest rates for homes, a lot of people can't even afford to get out of their home that's making them sick. Um, are you even able to help them? Do you help them? And if you do, how?
No, I don't help them at all. Just kidding. Uh, so, I mean, I can help in a number of ways. I suppose if I were a billionaire, I could probably help them financially better. One of the thoughts that I've had for a long time is that someone wise with a lot of money should build a lot of um, small homes for people like this, because of exactly what you said. But another way that I help more indirectly is my understanding that in the medical field, there's a lot of variability as to the knowledge of this illness. Because when I started, I didn't know anything. And now, by God's grace, I know quite a bit after 15 years and have even been considered an expert in courts and the like. But in the environmental realm, it's the same. There are mold testers that know a lot about chronic inflammatory response syndrome, and there are mold testers that don't know anything about it. I mean, they haven't even heard of it. And there are different kinds of tests, and some of them are very sensitive for finding mold, and some are not very sensitive for finding mold. In fact, if I were a landlord and I were not an ethical person, I know exactly what kind of testing that I would ask my indoor environmental professional to do, so that the likelihood of finding mold, even if I knew it was there, the likelihood would be really small of finding it. So part of my job is educating indoor environmental professionals and remediators too. There are remediation techniques that are amazing and are very effective. And then there are others that are kind of terrible and actually can make a place worse. For instance, if you don't put containment in it and you start ripping out walls, you can spread a localized mold problem to an entire apartment or an entire home. If you're not, I'm sorry, so that's remediation. If you're using biocides, for instance, and you're killing mold, that doesn't help the client, because if the client has chronic inflammatory response syndrome, that dead mold is just as bad for them. In fact, maybe it's even worse, because that dead mold breaks up into hundreds of fragments that then you can inhale, and they go deeper into your respiratory tract, and they cause your immune system to be activated, and you've got toxins and whatnot. So part of my job is educating the patients and educating the mold testers and educating the remediators and creating courses and speaking at conferences and whatnot to show them that there really is an important way to do this. And a lot of that work, I know that's a roundabout answer, but a lot of that work is preparing the patient. Because let's say they bought their house and they want to remediate instead of moving. If they pick the wrong remediator, they're going to spend $20,000, $30,000, $50,000 for remediation. And the place will be just as bad as it was, or even potentially worse, if the remediators that they chose don't really know what they're doing for this population of people, for patients that have CIRS. So that's a lot of my work, is just trying to educate the different segments that are involved with mold care in your home, uh, and the like. And then the second part of that is, let's say that instead you're renting. Okay? Well, now you have to interact with your landlord. And again, some landlords know a lot about this and they're very fastidious, and others don't care, and they just paint over visible mold, or they use bleach. They send their unlicensed maintenance crew in and they just bleach visible mold. Whether they know it's going to come back in a week or two or not, I don't know. Whether they know that it works or not, I don't know. But that's the kind of thing that I see all the time. And then the ultimate that happens from that is, when you can't get along, is then there's a lawsuit. And I've worked on the plaintiff side, I've worked on the defense side, but it ends up being a lawsuit, and that's another place where I've historically been able to help people.
Being an expert witness as you are, as you've given expert testimony for legal cases, can you share, what kind of injuries you've seen mold cause people that you've testified upon?
Yeah. So there are a variety of different things that mold can do. It can cause allergies that are modulated by one part of the immune system. It can cause asthma attacks. In some people, it can probably actually be the causation for them getting asthma. And so those are the things that most doctors know about. But more specific to what I do in chronic inflammatory response syndrome, Chronic exposure to indoor mold in people that are genetically susceptible or usually are genetically susceptible can cause a host of problems, and I can go from head to toe. We'll start with cognitive issues, problems with short-term memory, easily confused, difficulty maintaining their attention span, even to the point of sometimes they forget their own name or their spouse's name or their children's name. I mean, some pretty serious things. And sometimes that can be so debilitating they can't do their job anymore. You can also get headaches of any kind. So chronic daily headaches or tension headaches or migraine headaches can come from this. And we know they come from this because as we treat you, they get better or go away completely. You can have vision problems, multiple kinds, like bright lights can become quite annoying to you, or your vision can get blurry, or other things. You can have respiratory problems, chronic cough for no apparent reason, shortness of breath doing almost nothing, like walking up one flight of stairs, uh, even in a highly trained athlete, uh, can happen. You can have palpitations, tachycardia, where your heart starts racing, stomach issues like bloating, gassiness, actual pains, frequent or constant diarrhea, muscle and joint pains that are chronic. And if left alone, those muscle pains will eventually be called fibromyalgia. And then just this profound fatigue that comes over. Most people have some degree of fatigue, but for some people it's so profound, gets diagnosed as chronic fatigue syndrome, and it can be just debilitating. And you can lose your ability to go to the gym, where you might have been there 6, 7 days working out for an hour and a half a day. You go to the point where if you work out for 10 or 15 minutes, then you're bedbound for the next 2 or 3 days. So it really can hit you from head to toe. There are things I didn't mention, like you can have erectile dysfunction or loss of libido. You can have changes in your endocrine system. So cortisol too high, cortisol too low, urinating frequently, getting up multiple times at night to urinate, peeing up to, I've seen as high as 25 times a day. And that's just during the daytime. That's not including the nighttime. So it really can hit any system of your body.
How many times have you seen people get misdiagnosed with a different diagnosis when it really was mold? And what are those diagnoses that people have been given before they find you and understand the root cause is actually their environment because there's hidden mold there?
Yeah. At this point, I've seen over 2,000 people, and I'd say almost every one of them had at least one misdiagnosis because they had not seen a physician or a nurse practitioner or PA or who was familiar with this diagnosis, chronic inflammatory response syndrome. As far as what it looks like, it can look like lupus, it can look like MS, it can look like uh, chronic regional pain syndrome, can look like irritable bowel syndrome. In fact, it probably is what causes irritable bowel syndrome for most people. It probably is what causes chronic fatigue syndrome and fibromyalgia for most people who have it. It can look like Raynaud's disease or Raynaud's phenomenon. It can look like rheumatoid arthritis. It can look, I mean, I can literally go on and on. It can, on a good day, I can give you about 30 different diagnoses that it looks like. And it usually gets misdiagnosed into one or more of those, then you don't get better. It can be misdiagnosed as asthma, can get misdiagnosed as allergies. I mean, can cause all sorts of different kinds of skin rashes. So, yeah, so just a lot of possibilities.
What are your thoughts on mold causing a child to regress or look like they are exhibiting symptoms of autism? Because I know that they've mentioned that recently, where they're looking into mold being a potential root cause for children getting that diagnosis. What are your thoughts?
Yeah, that's a really good question. I mean, we talked about genetic predisposition earlier. You get a part of what's called HLA or human leukocyte antigen. You get a part of that from your mom, and you get a part of that from your dad. And if you get one that predisposes you from from your mother and your father, I call that a double. And if you have a double, if you have two of these bad genetic predispositions, you have to pass one on to every child because that's all you have. You have, bad 1A and bad 1B. You're going to pass either A or B onto that child, and then they're going to be susceptible. So one of the scenarios that I've talked about and written about is what happens to a mom who's a double, got a contribution from her mom and her dad, and she gets pregnant now. She's definitely going to pass on to her child, a genetic predisposition. What if dad also passes on the genetic predisposition? And now the child inside is a double. And there's literally no protection if that mom is gestating or going through her pregnancy in a water damaged building because she breathes stuff in and she can't take care of it properly. Some of these things, not all, but some of these things like ochratoxin A, for instance, can cross the placenta and get into the baby and cause damage before you're even born. So that's a scenario I think that we need to look at and study and find out how many of those kids later develop autism, or they're growing up, again, as a double, they're growing up, or even a single, but particularly as a double, they're growing up in that environment. Another thing that I've seen is that children, because I've seen close to 1,000 children. I don't know the number at this point, but they can get sick even if they're a single. They can get sick if they're a double. But what we typically see is that kids who are doubles get sick at a much younger age. So it may not be worse disease, it's just earlier disease. So I've seen kids 1.5 years, 2 years old that were already showing signs of chronic inflammatory response syndrome. And then we took care of their house, or the family took care of their house, treated them with cholestyramine, and they got much better in 2 weeks. Like their symptoms were completely gone. And then you asked about kids regressing. Absolutely have seen that several times, and several times it's gone to lawsuit. But I'll give you one example, and it's on my podcast, Medicine and Miracles. This is a little 4-year-old girl who was neurotypical. She was having no problems at all. She lived in New York City in an apartment, and they had Hurricane Sandy, and the apartment that she lived in flooded, and the parents didn't know what to do. And I mean, they got things taken care of, but not necessarily by a company that knew the right way to take care of it. And within 6 months, this girl went from being neurotypical to getting a frank diagnosis of autism, and not, high functioning autism, on the lower end of the autism scale, by a neuropsychologist. I ended up meeting up with the mom. We had a telehealth visit. We got the labs. We showed that the little girl had chronic inflammatory response syndrome. Took the history, did all that doctor stuff, and then treated her with cholestyramine. Within 2 months, she was back to normal and had just a mild speech delay. And saw another neuropsychologist who said, this girl doesn't have autism. She just has a little speech delay. And, I still know that family, and she's now in high school, and she's a cheerleader, and she's doing great. And in fact, she's on her little speech delay. She's now on the debate team in her high school. So no delay at all. And I have a number of cases like that where you took really high functioning kids, they moved into another house, or they had a problem like, with her in the hurricane. And over about 6 months or so, their cognitive abilities just really dropped. And then when we treated them, they came back to normal or almost back to normal. So definitely happens.
Thank you for talking about that, because I know it can be a touchy subject to go over. But I think it's so critical and important that people know that mold could potentially be a culprit in causing a child to regress, or potentially, like you said, maybe get autism because they were exposed to it while in the womb.
Well, I'm really excited, that RFK Jr. is taking this seriously and is starting to look around at causes of autism, and he's included mold as one of them that they're going to research. I honestly don't know how prevalent that's going to be, and then mold illness is pretty preventable. So if that is the case, if we do find that it's a major risk factor, major contributor to autism, as far as I'm concerned, this illness is completely preventable. Even if you're born with a genetic predisposition, you have to have the environmental hit. If you don't get the environmental hit, you don't get this illness. And so that's completely preventable. And so I'm just really excited to see what the research is going to show.
I am too. My oldest son, Sebastian, was similar to that little 4-year-old girl. He regressed into what they told me was severe autism. Just, it just happens, they said. But he's now in jiu-jitsu. Yeah, he's now 11. He's in jiu-jitsu. He just got a notification he's going up a belt. He's no longer considered autistic at all because it was mold that caused him to regress. And once we figured that out and got him better, he lost the diagnosis. So
Yeah, and that just happens, right? You just happen to lose the diagnosis of autism. No,
so yeah,
congratulations.
I love that you're helping kids and parents out there figure that out because it's preventable and it's also treatable.
That it is. And again, I look forward to the day, particularly as the current administration that we have is looking to actually find out what the root cause of chronic illness is, and see if we can't cut it off and at the knees. And they have a much more open mindset on how to approach that. And they'll probably do some goofy things, and they'll probably come to some interesting conclusions. But the fact that an administration is actually looking at it, and I think is really, I mean, this is a huge breakthrough, and this is the moment for mold toxicity, chronic inflammatory response syndrome, to really be recognized for what it is, which is one of the largest public health crises in the United States. It's an epidemic that people just don't know. And I'll throw out there, in 1999, there was an article that talked about what are called medically unexplained symptoms. Medically unexplained symptoms are symptoms like chronic fatigue syndrome, where you don't have any good biomarkers, any blood tests or whatnot that say, yes, you have chronic fatigue syndrome, or no, you don't. And people are still trying to figure out the pathophysiology, what is actually going wrong in your body. And that was 1999. That was 26 years ago. And we know more about it, but not very much. And my experience is that most people who I've met who are diagnosed with chronic fatigue syndrome started with a mold exposure and persisted with the mold exposure and fatigue. And after years and years, got to a point where it was very difficult to reverse. But imagine now that we had the mindset that mold could cause chronic fatigue, and we started getting serious about remediating our buildings, maybe changing our building practices and the materials that we use. Again, this becomes completely preventable. Well, how many people have chronic fatigue syndrome? It's probably about 3 million in the United States, probably 5 to 6 million who have fibromyalgia, another 5 or 6 million with irritable bowel syndrome. There are 10 million children in the United States that have chronic headaches, according to the peer-reviewed published literature. 10 million children between the ages of 4 and 18 with chronic headaches. My experience is about 90% of those can either be completely resolved or much improved just by getting them out of their moldy environment and giving them a binder, a strong binder for a couple of weeks up to a couple of months. The number one reason that adults see their primary care practitioner in the United States is because of abdominal distress. And it's usually after the gastroenterologist or PCP has done their full workup, maybe even includes a colonoscopy, they can't find anything wrong. Or maybe they just find some unrelated inflammation in the stomach or in the large intestine. And so they call it gastritis. And they don't know what's causing it. This is the number one reason that adults see it. They call it functional abdominal pain syndrome. Functional is a really nice word that we toss around in medicine, which means it's all in your head. You can't, your brain has made this up. You don't actually have anything wrong with you. And as an advent of that kind of thinking, we now have a whole branch of medicine called functional medicine, where doctors are specifically trying to find the root cause instead of just send you to the psychiatrist. So it's exciting. These times are exciting because we may really be able to make some progress in finding out what the problem is. And let me frame that just one other way. In medicine, we have a whole branch of, let me take a step back. The immune system has an adaptive part, which makes antibodies, and it has an innate part that doesn't make antibodies, but does almost everything else in the immune system. We have a whole branch of medicine that studies what happens when the antibodies go wrong, when the adaptive immune system goes wrong. It's called rheumatology. We have nothing that studies what goes wrong when the innate immune system is not working properly. There's nothing except like the work that Dr. Shoemaker is doing, and now functional medicine people are getting into it, and integrative people and naturopaths. But that's what chronic inflammatory response syndrome is. That's really what long COVID is. That's what post-sepsis syndrome is when your immune system has lost its ability to regulate itself and you're creating cytokine storms of varying magnitude. And that's causing chronic symptoms in the body. And I think we're going to find that it is the answer to most of the medical questions that we have. Not like how do we cure cancer, but why is this illness occurring and we don't understand it? Why is that illness occurring and we don't understand it? I think you're going to find that mold exposure and that chronic inflammatory response that comes from the innate immune system not being regulated properly is going to be the answer to a lot of those questions.
Do you think mold causes cancer? And if so, which kinds?
Yeah, that's a good question. And we know that aflatoxin, for instance, is a known carcinogen, and ochratoxin's right up there. The question is, how are we going to study that? Because I know people that have seen definite peaks and seen a lot of cancers associated with mold exposure. In my own practice, and I've discussed this with Dr. Shoemaker, we haven't seen that. So I'm not saying it doesn't happen. And I certainly have seen buildings where there have been clusters of cancer there, far more than what you would expect in the normal population. But as I look at the 2,000 patients that I've evaluated, I haven't seen that much cancer. So I don't really know the answer to that. And maybe that's something that we're going to start moving on as a result, again, of this administration change and this change of mindset. It's like, let's attack chronic illness.
Whenever you're trying to diagnose somebody with CIRS, how do you go about? Are there specific tests that you run on them
Oh,
to?
yeah, absolutely. In fact, you know, because I go to court, I know a lot about the peer-reviewed published literature. There are 3 different ways in the peer-reviewed published literature to make the diagnosis. They're very specific criteria. All 3 methods require you to have a lot of symptoms in a lot of different areas of your body. So multi-system illness. And when I say system, like your respiratory tract is one system, your eyes are another system, your cognitive breathing or thinking is a system, your peripheral nervous system is different. So problems in multiple areas, usually like 6 different areas or more of your body are affected, but at a minimum 4. So that's one part of the diagnosis. The second part of the diagnosis is certain lab tests, and that there are 10 different lab tests that we do. They include that genetic test I mentioned before, the HLA. There are a couple of chemicals that help regulate your immune system. One's called MSH, or alpha melanocyte stimulating hormone. Second is called VIP, or vasoactive intestinal polypeptide. There are 3 different cytokines. A cytokine is a molecule of the immune system that actually does stuff. and helps destroy foreign invaders, because that's what the immune system is for, is detecting foreign invaders like viruses and bacteria that get in the body so that they can't reproduce and kill you. So your job is to recognize that they're foreign and destroy them. And that's what your immune system does. The problem is, as you destroy them, as you release more and more of these cytokines, it's the cytokines that actually bring the symptoms, the brain fog, the fatigue, the pains in your muscles and joints, the nausea, the vomiting, the chills, the fever, et cetera, et cetera. It's those cytokines and the overproduction of those that bring those symptoms. So there are 3 different cytokines that we look at, and they're different than the ones the rheumatologists look at. We look at TGF beta 1, or transforming growth factor beta 1, C4A, which is a complement system protein, split product of C4, and MMP9, or matrix metalloproteinase number 9. So those are the basic chemicals, and all of those are related to the immune system, interestingly enough. There are some other things that we look at. There are hormonal changes from what we call the endocrine system. And so we can see that the antidiuretic hormone, which controls how much you urinate, and the serum osmolality, which has to do with how dehydrated you are, and those two are intimately involved with each other. We see dysregulation in that sense. So people who are on the verge of dehydration or are super dehydrated are peeing nonstop. I mean, those two things don't go together physiologically, but we see it in 5 out of 6 patients that have CIRS. We also see an abnormality in the HPA, or hypothalamic pituitary adrenal axis, and we'll see that same kind of dysregulation between cortisol and the chemical that causes you to make more cortisol, ACTH. And then there are a couple others. One is MARCoNS. That's that multiply antibiotic resistant coagulase negative staph, where you take a swab that's this long, and you stick it like all the way back in your nose. It's like a COVID test on steroids. Oh my gosh, very interesting test. But you pull that out, and 80% of people with CIRS, adults at least, will have a positive MARCoNS test. And then last but not least, we look at a couple of autoantibodies. Anti-gliadin antibody, which has to do with gliadin, wheat products, gluten, and anti-cardiolipin antibodies, which cardiolipins help make up, phospholipids help make up the lining of blood vessels. And so we will usually see at least 5 of those tests will be abnormal. That's actually shocking, because if I thought you had strep throat, I'd swab your throat. And if it was positive, I'd say you have strep throat. Just one objective abnormal finding is enough to make that diagnosis. And that's the way it is for the vast majority of illnesses. But I will almost always in adults see 5 abnormal lab tests, and in children, at least 4. And so that makes it so specific for this illness. It's just a really incredible burden of evidence to show that you have it, and yet everybody will meet that, who really has the illness will meet that criteria. That was a long answer, wasn't it?
That was a very thorough, very detailed, good answer. So thank you for being that thorough.
My pleasure.
When it comes to when you're about to start to treat somebody, other than having them leave the environment that's making them sick, is there anything specific that you have them do, like maybe nutrition wise, or things that they need to do before they start the treatment?
Yeah, there are a number of different things that you can try to do. I'm actually not practicing anymore, but amongst the best things that I see is maybe starting a no amylose diet and using the high dose omega-3 fatty acids for a short period of time. Some people do it for 5 days, some people do it for a week, some people for 2 weeks, but to take those before you start taking your binder. And that can help a lot in your ability to tolerate. A lot of our patients have chemical sensitivities. In fact, I'll be honest, I've never met somebody who had multiple chemical sensitivities who didn't have mold first. So I personally think that chemical sensitivities is kind of an offshoot. It's again, about 10% of our CIRS patients will have multiple chemical sensitivities, but those people can really have difficulty tolerating medicines. And so you may need to start your binder in little baby doses. So instead of 4 grams of cholestyramine, you might need 4/10 of a gram of cholestyramine. Instead of doing 4 times a day, you might just do it once a day to start with, and then work your way up. I think those are probably the most helpful things. Another thing that a lot of people do is they prime you with vitamin D3 to make sure that your D3 levels are at least in the normal range based on the 30 to 100 standard, but most people I know want it to be at least 50. And so those kind of things, priming the immune system and getting it ready for this and priming your body for the detox is really useful. And I think if it's okay, it's a good place to just mention that there are different kinds of binders, different detoxicants. Some of them are very strong and they work really fast, like typically within 2 to 3 months or even less. And some of them tend to be much slower. And so I'm a big fan of cholestyramine and cholesevelam, also known as Welchol, because they work super fast, but they're also probably the most difficult to tolerate. So there are a whole host of other binders like clays and charcoal and ochrapepsin and so there's mycobind and GI detox, and there's homeopathic products and there's natural products. And my experience is that those actually do work. They just take a long time. And what I've seen is that they can take 10 to 12 times longer for patients to get better. And that's the big difference between the Shoemaker protocol and a bunch of other protocols out there, is that if you can tolerate cholestyramine or cholesevelam, you'll get a lot better, a lot faster using those than some of these other binders that I call the wimpy binders. So, and literally it's 2 to 3 months versus for many people 2 to 3 years. And so if you can tolerate those stronger detoxicants, I think it's well worth it. But not everybody can tolerate them, and we understand that.
We get a lot of people that whenever they're exposed to mold, they're at that place in their life where they've been wanting to start a family. Would you recommend that they do the detoxing first and get better before they try that? Because can mold affect, you already said ochratoxin A can, pass through the placenta, but have you seen mold cause infertility or other issues with pregnancies?
Yeah, absolutely. So I think to detox first or not, that is the question. I usually say to pee or not to pee. That is the question. But that was Shakespeare. I'm just taking it from him. It depends. If you've got somebody who's 35, 36, 38, they may not have a lot of time, to go through the detox. If you've got time, I would much prefer somebody go through their cholestyramine or cholesevelam first and get their body in as good a shape as they can, get the inflammation reduced as much as they can prior to conceiving. But you can't do that with everybody. So just a thought there. As far as can this affect pregnancy? Absolutely. I mean, first of all, we know that it can affect libido. In men, it can affect their ability to get an erection. Can I say erection? Erectile dysfunction. So we know that it can interfere in those ways. Um, no studies have been done, to my knowledge, that actually look at um, fertility in men or fertility in women. We also know that about 60% of women in childbearing age are going to have significant problems with their periods. And I think it's probably the mold is affecting the LH and FSH. Again, it just hasn't been studied as to what the cause is, but I've seen that at least 60% of women get one, two, or all three of these symptoms, one being irregular periods, the second being like really severe cramping, like so bad you don't even want to get out of bed. And the third one being what we call menometrorrhagia, which is during your period, you just bleed a large amount, maybe even 10 pads a day or more, as the low end is 10 pads a day. So those things we see associated with having active CIRS, and I have no doubt that those can all affect, fertility rates. But once you get pregnant, there are other things that can happen. For instance, one of the causes of recurrent miscarriages is low levels of progesterone, and CIRS can definitely affect your hormonal levels and could lead to a situation where you have low progesterone. Another another factor that's been related to frequent miscarriages is a level of T regulatory cells, or Tregs. Now, these are a special kind of immune system cell, and what they do is they promote tolerance in your body as opposed to autoimmunity. So let's break those down for a second. Tolerance means if you have something in your body that your immune system doesn't like, you're less likely to destroy it. And autoimmunity is where you start making immune system problems, antibodies and whatnot, against your own body or things in your body. And so tolerance, you can't have too much of that. But if you don't have enough, you're going to abort the baby, because half of the baby's DNA is mom's, and mom's body loves that. Half of the DNA is dad's, and the immune system does not love that. It wants to get rid of that. So what we actually see is, as women get pregnant, their T regulatory cell levels go up, and they stay up throughout pregnancy until it's time to give birth, and then they suddenly drop. And maybe that's even the signal to start basically aborting the baby. Get it out of here. Okay. I know that's kind of a crude way of saying it, but that may actually be the signal that starts labor for some women, or maybe for all women, is that these T regulatory cells drop, the tolerance goes down, the immune system says, get that thing out of here. I know that puts the whole miracle of birth in a different perspective, but so be it. What we see with women that have recurrent miscarriages, oftentimes their T regulatory cells don't rise. They're actually low. And what we see based on the work of Dr. Shoemaker is, when you have CIRS and your CIRS is active, your T regulatory cells aren't normal, they're low. So you're actually doing the opposite of what you need to do to keep the fetus inside you for long terms. So those are the things that we know. There may be other things that we don't know yet, but that's quite a bit. I can't hear you right now, Emily. I think you have mute on.
I did have mute on because my dog started barking. I apologize.
It happens.
Thank you for going over that so well, so people can have that information, because that is such a critical topic that a lot of them face, unfortunately, and I know that many of them have experienced many miscarriages and they don't know why, and you just gave them their potential answer of why they've been having these miscarriages. So thank you.
Well, those are definitely things that the obstetrician can test for, looking at T regulatory cells and also looking at progesterone levels. And if you can treat in such a way to optimize those, those are a couple of big reasons for miscarriages that you can avoid.
What are your thoughts on SIDS and mold?
Yeah, that's a really good question. That hasn't been studied yet either. And part of the reason is because you usually make that diagnosis of SIDS in the first 6 months. And some people will do it in the first year. And there's almost no data on chronic inflammatory response syndrome in children that age. I mean, I've certainly seen it, as low as a year, but there just isn't much information on that. Could it cause? Yeah, I think it could. It definitely could. There are other mechanical factors though also, like, that's why we have babies sleep on their back and whatnot. So those mechanical factors, closing off the airway, can be involved too. SIDS is an illness that's diagnosed when the autopsy of, tragically, the baby's died, and you do the autopsy and they don't find any obvious reason of why the child died. But if you're not looking for CIRS, you don't know how to look for CIRS, you're never going to find it.
Let's talk about Moldco in your position.
Yeah, that's a lot happier than miscarriages and SIDS. Wow. Mold.
Hey, I'm sorry I asked you those questions, but I do want to ask some of those questions because I know that there are some families out there wondering why their child never woke up. So,
Absolutely.
um, and the fact that they're not looking for CIRS when they're doing those autopsies. I hope one day they will start doing that to maybe hopefully give some answers and have these studies done.
Absolutely. Well, like I said, we're going in the right direction now. We have an administration that wants to solve what's going on with chronic illness, and I think they're looking in the right places.
Yes, I'm hopeful with this administration, so I'm excited about the future to come. And you now with this new position as medical director with Molco, can you share what you're doing, what your goals are, and how you're helping people?
So one of the things that most people are probably aware of is there are a shortage of practitioners who have had training who know how to treat this illness. And I would estimate, based on conversations I've had with Dr. Shoemaker and people that have gone through his training uh, seminars and whatnot, probably about 400 providers in the United States. And that may seem like a lot, but we're looking at 50 million potential patients. So 400 is not much. On top of that, there are other people that have been trained through other mechanisms, and I don't want to name any names, but they use different ways of treating. For instance, they use antifungals, which we know can be harmful to the brain of our patients. And different they use different diagnostic techniques like urinary mycotoxins, which, you know, urinary mycotoxins doesn't diagnose any illness. It does show that there was an exposure to either inhaled or ingested uh, mold and its toxin, uh, or maybe both, but it doesn't make any diagnosis. And there are a large number, when I say large, I'd probably say maybe 1,000 people in the United States that are making a diagnosis of CIRS or mold toxicity based on a urinary mycotoxin. And I would say, tisk, tisk, tisk. There's another problem, and that is that the people who work within the Shoemaker protocol and who've gone through his training, we've been taught you need to publish because you can't really change medicine if you don't publish your data in the medical literature, have it peer reviewed, go through that rigorous process of somebody else who you don't know reading your stuff and saying, yeah, that makes sense, or yeah, you did that right, the way you did that study. And that's interesting, the results that you got. I would say the majority of people in the United States right now who are treating mold, they don't go through that process. So it ends up becoming just their opinion of what's the best way to treat mold. And I don't think that that's particularly helpful. I'm appreciative that they brought more awareness to this illness through their podcasts and their social media activity and whatnot, as they're probably also building their empire. I am not pleased that they don't publish and that nobody has to date published a head-to-head Dr. Shoemaker's protocol versus one of these other protocols. There is no data like that because the people that do those other protocols don't publish. I kind of went off on a tangent there. Could you remind me what the original question was?
How Molco and like what your goals are, the direction you're going, and
Wow,
um,
I went into outer space there. My apologies. So where I was going with that is that there's a paucity. There are not a lot of highly trained people like myself who have experience and who really know the nuances of how to diagnose and treat this illness. Certainly, like I said, 400, if you take in consideration the people that have gone through alternate training programs, maybe there's a couple thousand of us for potentially 50 million people. Now, as a result of that, this is where I was really going. As a result of that, there are long wait times to see practitioners that are knowledgeable. I mean, I frequently had 6-month waiting lists and even longer for new patients because there's only so many people I can see. There's only so many patients that my staff and I can take care of. Alternately, Private insurance will pay for mold care. You have to know how to code it, but they'll pay for mold care. The problem is they don't pay for long visits. And these patients have multiple problems in multiple areas of their body, and they're flying in to see me from Maine or Hawaii or Florida. And so I can't just give them the 15-minute visit and brush them off. We set up 2-hour-long visits to go through all of their medical information. And to be honest, oftentimes we spend 3 or 4 hours with people to do that. So again, long waiting periods. And because insurance pays very little for that 2-hour appointment, very little compared to the 5-minute ear check or the 15-minute well child check, very little, like a third as much. You can't run your office taking insurance. So now to break even, you have to charge a lot of money for that 2-hour visit that is not going to be covered by insurance because you don't accept insurance. So that's out of pocket. The lab tests usually are covered for the most part by insurance. But if you don't have insurance, then that's all out of pocket. So this becomes a very expensive illness. And there aren't many practitioners, and there's a huge unknown number, tens of millions of people that are suffering. So how do you solve the problem once the populace becomes aware of this illness? It's estimated only 5 to 10% of people are aware of mold illness. What happens when 50% are aware and they want to get screened? They want to find somebody who can help them determine, number one, do you have chronic inflammatory response syndrome? And two, help treat it so I can get better. How do you solve that problem? The answer is Moldco. Moldco is using efficiencies that can occur by creating a new form of medical healthcare delivery. I mean, it's been done for really simple illnesses like, well, I won't go into it, but it's been done by other companies like HIMSS or HERS or Roman or whatnot for very narrow, medical spans. The illness of chronic inflammatory response syndrome or mold toxicity is a huge illness. And it's never been subjected, or no illness like it has ever been subjected to what we're doing at MoCo. We're actually creating a brand new way of delivering healthcare. And I think we're doing it quite well. When we get to full speed, we'll be able to handle millions of people nationwide, maybe even tens of millions of people. And instead of having to wait 6 months or a year to get to see somebody, we'll be able to basically, you can be seen within 24 hours. And instead of having to spend thousands of dollars for your first visit, right now the going price is $79 a month for a membership with Molco. So we're solving two of the really biggest problems, which are accessibility and affordability. And we're doing it using the Shoemaker protocol, which is the only peer-reviewed and published way of treating chronic inflammatory response syndrome mold toxicity.
I love what you're doing, because that's one of the biggest hurdles for people is the actual financial aspect of, can they even afford to go see the doctor? And if they can, most doctors that specialize in this, such as yourself, they have such long waits, and it just puts those parents and those kids just in a position of not getting help when they really need it at that moment. So it's amazing what you are doing. I'm very excited that you are expanding in all the states by the end of 2025, or?
That's our goal. Right now, we're active in 5.
Okay.
And our goal is to be active in all 50 by the end of the year. We've already put the business structures in place. It's just getting the approval from the individual states.
Got it. Let's talk about your podcast. You mentioned it to me when we first got on, and it sounds amazing. I love the fact that you have this such amazing, strong faith. I didn't know that about you. And I love that you are bringing miracles into your podcast to talk about faith as well.
Right. So Medicine and Miracles, I'll do my little self-promotion there. Medicine and Miracles is the podcast I have. It's on YouTube, Amazon, Spotify, and iHeartRadio at this point. Someday maybe we'll be on Apple or TikTok. But Medicine and Miracle, well, who would watch it on TikTok? Brr, not a long enough attention span. But Medicine and Miracles is a show where we have three different segments. The first segment, so I explain something about CIRS. Like right now, I'm doing a series on the individual symptoms that we see, or sometimes grouping of a system, talking about those symptoms that we see with CIRS. But sometimes we talk about other things, like once we talk about how airplanes fly, and once we talk about radioactive carbon dating and the things like that. But for the most part, it's CIRS based. And after that segment is over, then I talk about miracles that I've seen, miracles that friends of mine have gone through, seen people literally raised from the dead, seen CIRS literally disappear with prayer. And when I say that, we usually tell people with CIRS, you have to stay out of your bad buildings for the rest of your life. But I've seen people be so recovered that they could go into bad buildings, even though they still had their genetic predisposition. There's nothing that I can do in medicine that would cause that. I mean, I can help you get a lot better and manage it, but I can't make it go away. And I've seen that happen in several people. Seen financial miracles, we've seen healing miracles, seen relationship miracles. I mean, just seen a lot of different things happen. And that's the second segment. And then the third segment is what we call the moment of hope. And that is, as we're finishing up, just giving you a bright thought for the day, a different way of looking at things. Sometimes it's a Bible verse, and just showing the goodness of God and the graciousness of God, and reminding you that he does heal to this day. He does speak to you this day, and he is amazing, and he's worth looking into, and his word, the Bible, is worth reading, and he's worth talking to, which is prayer. I mean, that's all prayer is. It's just talking to him, and he's worth it. And I hope that it's powerful, because I'm clearly trained as a scientist and have published a number of um, articles about CIRS in the peer-reviewed literature. But God got a hold of me, 33 years ago, and completely changed my life. I had achieved. I don't tell this story to many people, but by the time I was 30, I had achieved everything that I had ever set out to do in life. I know that sounds crazy. Maybe my bar was too low, but everything I'd set out to do, I had already accomplished, and I just didn't know where I was going. And as a child, I had a rough childhood. Some people had worse than I did. Some people had better than I did. I had a rough childhood, and coming through that, the only thing that probably kept me from killing myself as a teenager was this thought that I was going to be a doctor someday. I mean, literally, when I was 4 years old, I was telling people I'm going to be a doctor. I don't know why I knew that. I don't know why I latched onto that. Maybe God said something to me. I don't remember the event. I just knew I was going to be a doctor. And that hope, hope is what got me through. But then when I was 30 years old, I'm now a doctor, and I'm practicing, and I'm starting to make, more than McDonald's wages, for money, and getting out of debt. And what I realized was the misery that I already had in my life didn't change. I mean, I was in fact, I was more miserable, because the hope that I had has now been dashed. I mean, I got through it all, but I didn't realize that wasn't what I was really looking for. And it's at that time that God actually started talking to me. I mean, I heard his voice in my head. This is 30 plus years ago. I'm not insane or anything like that. He started talking to me. And the result of that was I ended up realizing that my own abilities, my own power, my own intelligence are so limited compared to what he has. And it is foolish of me not to seek him, and not to find him and not to bow down and say, you are God and I'm just a human. And I don't even know why you have any interest in me, but you do. And then to come and find out that he loves me. And that whole John 3:16 thing, where God so loved the world, for he so loved his creation. He so loved Scott. He so loved Emily that he gave his only son to die for us. I mean, that's an invitation. How can you say no when the creator of the universe says, I want to be your friend. I want to be more than your friend. I want to be your provider. I want to be your teacher. I want to be your confidant. I want to be the person, well, person's the wrong word. I want to be the one that walks with you through all of life's difficulties and struggles, because you still get difficulties and struggles as a believer. You just get the God of the whole universe walking with you. And Jesus and the ability and the Spirit of God. It's like we were talking earlier, how do people live without that? I don't know how I survived 30 years without that. Well, I do, is I had a hope. Now, the hope was in the wrong thing, but I thought that hope was going to take care of everything for me. And when I found out it didn't, then that's when I found the real answer was in Jesus and God and the Holy Spirit. And so that has every good thing that's happened to me in my life since that point. I can point to, Jesus doing it. Every miracle I've seen, people, like I said, raised from the dead, outcomes that shouldn't have happened, financial miracles, meeting my wife. I mean, my wife was I had a dream one night. I mean, there's a lot longer story, but I had a dream one night that I saw this woman standing next to me. She was Black. We were in Africa. It was clearly in Africa. I'd been there twice. And I could tell in the dream I was pregnant, or she was pregnant with my son. And because I teach and preach that you shouldn't have sex before marriage, I was actually living that out as a single man. And I had this dream, and I figured if she's pregnant with my child, she must be my wife. And I was getting ready to go to Africa for the third time in about 3 weeks. And I just called up my guy, the guy who hosts me, and I said, hey, uh, I'm coming out in 3 weeks. I'm gonna meet my wife. I mean, I said it. I said the words. And on the plane ride over, I heard God say, you're going to meet somebody. And I was only there for 3 days in that location. And I met my wife. And we've now been married almost 16 years, had 5 kids. I mean, that's just the way I live my life. And God has been so good. It's the same as the pediatric multi-exposure colon, the next great epidemic. You may look at that and say, that's crazy. You're a professional, you're a scientist. Why would you do that? Because God knows everything, and he certainly knows better than I do. And I've just kind of tried to gauge my life to listen to him and trust what he says, because he's never steered me wrong. And so that's the greatest part of my life. And then I've been married to an amazing woman for nearly 16 years, and 5 children with her, and 3 from the previous marriage. So I am just a blessed man. I get to have 8 children, an amazing wife, an unbelievable career, so much more than anything I ever asked for. And the only thing I can say is it's because of God. Oh, I was talking about medicine and miracles. So hope, hope is what our patients need. They've been to so many doctors that have told them it's all in your head. There's nothing wrong with you. I did the lab tests. They're all perfect. Maybe you should go see the psychiatrist. They don't have any hope. There's something wrong with it. It's like that woman in the vision that I had back in early 2010. Do something, God, because I have no hope. Everything I know to do doesn't work. And that's where many, many mold patients are. It's like, I just don't know what to do. I'm, yeah. Anyway, so that's what I get to do. I get to bring hope. And sorry for rambling there with my God stories, but I could do that all day of just the amazing things that God has done in my life and that He can do in your life and that He can do in your viewers' lives. You just have to believe Him.
I love that you end with hope. That's one of the things that this foundation is all about, is giving the people hope that are going through mold, to let them know that you will get through this. It's just a matter of time.
That's right. That's right. And there are people that know how to guide you through this. There are, doctors and nurse practitioners and PAs and naturopaths and even like some chiropractors and whatnot that can help bring you through this. There are health coaches, a lot of whom have experienced the illness themselves, who've gotten through it, who can help bring you through this. There's all sorts of information, but you have to be really careful where you find your source of information. And I, the only thing I can say is, if your mold tester doesn't know about CIRS, probably should get a different one. If your mold remediator doesn't know about CIRS, you probably should get another one. If your doctor doesn't know about CIRS, you might consider getting another one, or at least finding a specialist who actually knows about the Shoemaker protocol and practices it. And the reason why that's important is it's the only peer-reviewed and published way to treat mold toxicity, chronic inflammatory response syndrome. Everything else is guesses and opinions.
Yes, I was thinking when you mentioned about the mold testers, coincidentally, yesterday I was calling around for this woman who's very sick. She's not in my state, and she just asked if I could help her find a good inspector in her area. And so I said, sure, I'll call around and vet them. And on their website, it said that they do the testing and the inspection. But when I spoke to them, his testing is testing. And then when I asked him about how he does his inspection, he says he goes in there and he does air sampling and surface sampling. I was like, well, that's testing. We
Right. No
testing.
visual inspection.
What do you do for the inspection? And he explained that to me. He said, well, that is the inspection, is the testing. I said, but it's on your website that you do testing and an inspection. That's not an inspection, that's testing.
Right. There's such a huge gap in the medical world and also in the environmental world of people that know little or nothing, and they don't even know what they don't know. And then people that are well versed in this and actually um, can help you significantly. It's and how does the patient know? How does the patient know what kind of doctor to find? How does the patient know what kind of inspector to find? Um, because everybody comes in confident, like, yeah, I've been doing this for 8 years or 15 years. I've seen 2,000 houses and whatnot. But then it turns out they're just a pump jockey, and they do sport trap in your living room and sport trap outside and charge you $700, and they're out the door.
Mhm.
How do you know?
Yeah, it's hard. It's hard to figure that out. And I'm so grateful that you're out there and you're doing what you're doing. And thank you for all that you've done for this community. I truly appreciate it, and I sincerely respect all that you've done for everybody and that you're continuing to do. So thank you.
Well, thank you. And I'll just one last plug to answer that question, how do you know? And that is, you can go to cirsx.com, CIRSX.com, and there are more resources there than you can shake a stick at. There are hundreds of medical and environmental articles. There are hundreds of videos. There's a glossary where we break down the individual terms for both medical and environmental. There are videos on how to pick an inspector, how to pick a medical provider. There are explanations. There's one place where I've taken all the different physiologic things that occur in your body and go through them one at a time and explain them on like a fifth grade level of what that actually means in a way that lay people can understand it, so they can understand what's going on in their body. And so CIRSX is a tremendous resource for those people. CIRSX.com.
That's great information. So everybody go check out those resources on cirsx.com. And thank you, Dr. Scott, for
Thank,
coming on this podcast.
thank you, Emily. I really appreciate you taking the time. God bless you.
You too.